everyone, welcome back to another episode of Inspiring Voices. Today, we are pleased to host Dr. Swati Gaba on our podcast. Dr. Swati is a prosthodontist with 17 years of clinical experience as a prosthodontist and 22 years as a general dentist, as well as 13 years of academic experience as an associate professor and postgraduate guide at YMT Dental College and Hospital, Mumbai. She did her Bachelor of Dental Surgery from Rajiv Gandhi University in Bangalore and her Master's from Rajasthan University of Health Sciences. She was an executive committee member of Indian Prosthodontic Society Mumbai, Navi Mumbai branch, for 2 years and one of the founding members of the same. She was a part of an organizing committee for the National Conference of Indian Prosthodontic Society in the year of 2016 and 2025. She has several published papers in national and international journals and is an active participant in various conferences, including being the chairperson of various sessions. Since 2021, she has also started her journey as a home baker, specializing in millet based bakes under the name of the Radical Oven. Thank you, Dr. Swati, for taking some time out to talk to us and share your insights.
Thank you so much, Avni. That was a very kind introduction. I have been looking forward to this podcast.
Thank you. So, could you please share with us something about your growing up journey that inspired you to take up this profession?
So my inspiration really started at home. My father is a doctor, and a lot of his friends are. So I grew up in a surrounded by medical world. It may feel strange to some, but hospitals have always felt like home to me. I am one of those people who actually love the smell of a hospital. And I also remember the thrill of watching my dad performing surgeries in operating theaters where I used to accompany him at times. Interestingly, I did not set out to be a dentist initially. I was aiming for MBBS. But looking back now, I wouldn't change a thing. I have dentistry has found me, and I think it's a perfect fit for me. It's a specialized field that I have grown to love a lot.
That's interesting, and it's good to know you love your field.
Very much.
So, what led you to specialize into becoming a prosthodontist, and how is it different from being a dentist as we know them?
Okay, this is going to be a little long answer because prosthodontics is really close to my heart. So I don't want to leave any aspects of this. So I chose this specialization because it is an intersection of art, engineering, and biology. So once I got into dentistry, I just didn't want to treat pain. I wanted to reconstruct the smile and restore the function that people have lost over the time. And I found my place in oral rehabilitation. So, prosthodontists are reconstructive experts of dentistry. They handle complex cases that require specialized skills and knowledge. You can consider them as mouth architects and designer. They are the smile creators who do their best to recreate what God or nature once gave us. For this, person needs to, after the graduation, they need to undergo 3 years of additional intensive training which helps in specializing in replacing missing teeth, fixing complex oral structures using implants, crowns, bridges, veneers. It may be for cosmetic or health reasons. However, this particular specialty of dentistry goes much deeper than just teeth or mouth. A prosthodontist also specializes in the entire maxillofacial region, which means we don't just replace teeth, we also create prostheses for eye, ear, nose, parts of skull, and it also extends at times to reconstruct missing fingers or toes. These can be because of trauma or some kind of accident, cancer, or anything. And furthermore, our role also extend into daily mechanics of life, like treating the TMJ disorders, chronic clenching, chewing difficulties, also going for appliances for snoring and sleep apnea. So finally, concising it all, it's not just about the function, but it is also about giving back person their confidence in their sense of self and restoring their quality of life. General dentists, on the other hand, I would say are like a jack of all trades in dentistry. They do they are like general physicians who keeps you healthy day to day, handle routine dental care like checkups, cleaning, cavity filling, tooth removal, etc.
That's interesting. The field sounds really interesting,
It
especially the
is.
way you described it. So, which part of your job or your role gives you the most satisfaction?
Um, so for me, the most profound part of this journey is the sense of gratification and contentment that comes from a patient's reaction. When we provide a new set of teeth or a complex prosthesis, it is a life-changing event for that person, because we are not just restoring the form, function, and speech, we are also giving back their comfort and confidence. So there's a visible sense of elation and gratitude when a patient looks into the mirror and sees themselves again. So, knowing that my work allows someone to eat a meal without a pain, speak without hesitation, smile without hiding their faces, it is the greatest reward for a clinician. And I was an academician before, so passing all this, which I feel, to another generation is another form of happiness that I get from my work.
That's interesting. It's nice that like you like to help, like the feeling, the gratification. I think that's
Yes,
really important in such a field.
right.
So, in your views, what qualities does one need to have to become a successful prosthodontist? Like, how should one prepare for a career in dentistry?
So I'll start with how should one prepare for a career in dentistry, because the qualities I feel would be overlapping for both. So to building a career in dentistry in India, one has to give a common entrance exam known as NEET, which most of us know it. Through that entrance exams, you are qualified for admission into various dental schools across India, and then there are certain private institutes which have their individual entrance exams as well. But if you wish to take up this career and go to like in internationally, like in United States, then you have to first finish a 4-year undergraduate degree in some sciences, particularly dental sciences, and then you dive into the specialized doctoral programs like DDS or DMD. If you are eyeing for UK, Australia, or certain universities in Europe, the roadmap changes slightly. Some of these regions offer direct entry to undergraduate courses, but all these countries are highly university specific. So you are not just applying to the country, it is a specific institution standard where the goal is the same and roadmap might be slightly different. Now, coming to the qualities, to be a successful prosthodontist, it requires a unique blend of a surgeon's precision, an architect's foresight, and an artist's soul. However, the most basic requirement, in my opinion, to get into the dentistry per se is the aptitude. You must totally have that the aptitude required for this profession. And the essential basic qualities required, I would say, make patience your superpower, because dentistry and prosthodontics particularly is a game of millimeters. You have to discipline your work through complex, long-term treatment plans where rushing is not an option. Then you must have compassion and empathy, as you are restoring a person, not just a teeth. And you have to be guide to your patient through the emotional journey of the reconstruction. You need to have a multidisciplinary mindset. You cannot work alone in this profession, because you need to be coordinating with other specialities of dentistry as well, and to make sure that the entire oral system work in harmony and as a whole. And then finally, you need to give your total devotion and must have a hunger to learn, because this is a science which changes every day, especially in the AI world. And it's a lifelong learning to master the ever evolving science.
Yeah, medicine is evolving a lot with technology as well.
I think,
It
yes, that is
is.
why we are always practicing and never perfect.
Yeah. Would you say it's more about having creativity in the way you approach each patient or the way you use like technology and equipment at hand?
So it has to be a balance between the two, because you need to know the ever evolving technologies. They are changing every day, and the creativity and the art is lies at the basis of it.
That makes sense. Yeah. So you also multitask as an academician besides managing your own clinical duties. What led you to branch out into this dual role?
Okay, well, even though now I'm a just a full-time clinician, I was often asked why I chose to wear the two hats. So honestly, my decision to branch out in this in this dual role was all about the synergy between professional passion and personal balance. Um, for academics, I have always believed that if you want to learn something better, teach it. It's a unique kind of intellectual discipline that kicks in when you're standing in front of student. You end up studying actually harder to teach a subject than you will ever do to pass an exam. But it's more just than staying sharp or learning. It's also about bridging the gap between the theory and reality. One side, the academics gave me that, but the other side, even though textbooks are great, the clinical practice is a kind of a messy hands-on skill. Each patient is different. Each patient is an individual. So by bringing those real chairside world challenges into the classroom, I was hoping to help the next generation prepare for what they will actually face once they are a graduate. So it's a two-way street, though. The academic worlds give me access to the cutting-edge resources, the libraries, the research, the journals, and which I may not have in my private setting. And it provided me with a community of peers that have become one of my closest friends now. And on personal level, it is my anchor. While the clinic provides the economic drive, the I should not lie about the finances part of it. The academia offered the structural stability of fixed hours, the annual leaves that I needed to recharge and be present for my children, my family. At the end of the day, the clinics gives me the reality, and institution gives me a growth. Balance between the two kept me grounded and kept me going.
That makes sense. Yeah. A lot of what you do is like balanced, like perfectly in the mix, a healthy amount of everything. But I understand your
Yes,
point about how teaching helps you understand and love your own field even better. Yeah.
absolutely.
So, did you feel at any point being a woman made it tougher for you to balance your multiple professional roles with your personal life as well? And did you at any stage have to choose one over the other?
Okay, one thing I'm incredibly grateful for in this profession is that your quality and efficiency aren't judged by your gender. Your work truly speaks for itself. A doctor is a doctor. And I'll be honest about my brand of feminism. I believe that if I'm going to advocate for my rights, I have to just as be committed to my duties. So I've always tried not to look at my gender as an excuse for the hurdles. Instead, I focus on how I navigate my responsibilities and duties. That doesn't mean that there haven't been seasons of adjustment. With my firstborn, I chose to take a small break and adjust my work to be more present with him and to understand the parenting. But by the time my second one came along, things shifted a bit. I didn't take any extra time or leave beyond the maternity leave because my son actually joined the workforce with me. I carried him to my job for nearly 2 hours, and I'm actually eternally grateful to my workplace management for granting me that freedom. And moreover, in India, we are fortunate enough to have access to great crashes and affordable help. So let's just take advantage of that to make our life easier and to stay organized. Um, I have found balance that doesn't come from a gender based struggle. It comes from a clear decision making. The reality for any professional, whether it's a man or a woman, is that you simply cannot be everywhere. You need to just, it's a basic criteria which you have to understand. For me, particularly, it has never been about being a permanent choice between a career or a family. It's about the art of constant prioritization. I just look at my life and ask, what is the most important thing at this exact moment? And I give my energy there. But before we move on further, I would like to touch on something personal that often gets swept under the rug. I have been there, and we all females have been there. We know the physical and mental toll of a menstruation that is treated as a silent struggle in the office. My advice would be, don't let it be a taboo. If you're having a difficult time, talk to your colleagues. You shouldn't have to carry that in isolation. You should just be willing to start a conversation. And I always go back to the famous line from Professor Dumbledore in Harry Potter: help will always be provided for those who ask for it.
Yeah, yeah, I agree with that completely. I get what you mean about being a doctor. Is it is what it is. It's your career. Like if you're
Yes,
able to satisfy your patients, then it's a job well done. And I also think it's
right.
really important for a lot of girls to realize that it's not one or the other. You don't have to choose starting your own family or your career. There's plenty of successful women who are examples of how you can balance both of them.
Absolutely. You need to just try and make best of what you have.
Yeah. So, what would be some advice that you can share with our audience on time management as well as work-life balance?
As I mentioned in my previous answer, if I could boil it down to one thing, it would be the power of prioritization. You have to accept that you cannot be everywhere at once. You cannot give your 100% to multiple things at the same time, and it's completely okay. It's acceptable. You need to give. Moreover, you need to give as much importance to yourself as you give to your family, your career. We often put ourselves at the bottom of the list, but you don't have to do that. You need to refresh and reset to actually be effective in other areas of the life. Follow the oxygen mask rule. Help yourself first before helping others. In practical terms, it just means make a schedule that actually accounts for not just your work, for your leisure, uh, and not just your deadlines, for your hobbies, for your other things, life, family. If it is not on a calendar, it doesn't usually happen. And most importantly, lose the guilt. Whether you are taking out time for anything, your family or for yourself with your friends, don't just feel guilty about it ever. um, and try to make, like I do, I try to make sure it is more about quality than the quantity of the time. Be your 100% wherever you are. Some days you'll get everything done, some days you won't. Just take each day as it comes, manage what is in front of you, and give yourself the grace to try it again tomorrow.
Yeah, I agree with that completely. I know a lot of people will feel guilty thinking, I haven't finished everything that I'd planned to do today, but they overlook everything good that they accomplished and that they gave their 100% towards. So I agree with
Yes.
that, as well as spending quality time with family and friends. It might not seem like the most productive use of time in terms of academics or career wise, but it's still a productive time to like re-energize yourself.
And believe it or not, you learn a lot that way too.
Yeah, I'm sure. So looking back, is there any message you would want to give to your younger self, which might be of use to our audience as well?
um So looking back, I would start by saying that by God's grace, I have had a truly great life filled with wonderful family, incredible friends, and a career that I love. I'm very lucky in that way. But if I can sit down with my younger self, who is just starting out, I would give her some very specific piece of advices. Firstly, don't ever lose your spark. Keep your hobbies, stay passionate, and travel more. This is something I learned later in life, that these experiences aren't distractions. They are what make you a more empathetic clinician, a better parent, and a more fulfilled human being. Secondly, and very importantly, I'll tell her to learn the power of no much earlier. I've spent a quite a lot of time being diplomatic, trying to please everyone, and ultimately I realized that being assertive isn't being rude. It's about being protecting your boundaries so that you can give your best to what actually matters. It's far better to give a firm no early than a resentful yes later. And finally, again, a very important point I want to very much emphasize this is to take care of your health from day one. We often have this mentality where we always outwork a bad lifestyle. We work hard, we party harder, but we have to fuel ourselves just as intensely. Don't wait for a burnout or a health scare to start eating well and exercising. Make it a part of your daily routine. Treat your physical well being with the same discipline that you apply. It's for me that I would apply the same discipline to my clinic. My surgical precision should be to also my health care and my lifestyle. And I'm sure my future self would be thankful to that for the strength I would have been building as a when I was beginning. So I would just say that
Yeah.
career is a marathon, and keep your passion alive, protect your time being assertive, take care of your health, and always make room for people and experiences that make life worth living.
I think this is something a lot of people would need to hear as well, especially the part about taking care of your own health first and maintaining like a good balance with everything, being open to new experiences and saying no to not try to
Right.
please everyone. So, is the version of success that you live right now the same success that you had imagined as a little kid?
uh, I don't know really, but I am very happy at the place where I am. I'm very content with my success. I would not consider it as a successful career, just as a successful career or as a person. But overall, if I look at my life, I'm very happy, content, and I feel it's quite successful in the terms that I have a loving family, I have wonderful friends, I'm doing what I love. I am not just working, I'm also taking out time to play, be with my friends, travel, and everything all in one. So the package turned out to be really good at the end of it.
That's good to know. And I think that'll give a lot of other girls hope that they can also have such a balance in their life.
Of course, and one more thing, I started a small entrepreneurial journey very late in my life, which is like recently, and I'm building it up slowly and steadily, and I'm happy diverting from my field and doing something new.
That makes sense. Like another kind of side task, something outside
Yes.
of your career. Yeah, that sounds interesting as well. Thank you so much for your time, Dr. Swati.
Thank you so much, Shavni, for having me. It was lovely chatting to you.
Thank you.